Hi, I'm Dr. Emily Grewe-Nelson, and I'm going to be going over utilizing the ASCVD risk estimator in increasing patient compliance with medications such as statins, as well as treating risk factors to goal. So we're just going to go through a couple cases here. This is the American College of Cardiology's ASCVD risk estimator. I use this quite a bit. It both has a computer screen as well as there's an app too that I utilize. So we're going to go through a couple cases. The first one's going to be a 46-year-old Caucasian female, blood pressure of 124 over 80. Her cholesterol total is 183, HDL is 39, and LDL is 90. She does not have a history of diabetes, does not smoke, she is on blood pressure medicine, is not on a statin or aspirin. And this just asks if you want to compare it to anything previously. So then I go over here to my therapy impact, and you can see it gives me three numbers. First is the 10-year ASCVD risk. So that's your risk of having a heart attack or stroke or other acute coronary event within 10 years. And then it also gives you lifetime risk. So some of you may know that the threshold for statin use, where statins have been shown to benefit this, is over that 5% 10-year risk. It also gives you an optimal number. So optimally, her risk would be 0.4%. And then you can go down and see how can we reduce this patient's risk of coronary events, cardiovascular events. So the only thing here, there's 4 categories. The only thing that we're able to do is start her out of blood pressure medication. So her blood pressure was slightly above what their recommendation is. So if we added that, it would be 1.2%. So let's go back over here because I want to change this just a little bit. And I do use this quite a bit when I'm talking to patients. So if I have a patient who comes in for lab work, maybe has, like this patient has high blood pressure, we're checking for cholesterol, whenever I see them back, we'll go over this, I'll plug in their numbers and kind of tell them this is how I determine what kind of treatment we need to do. So maybe it doesn't look like you have high cholesterol, but when we look at your overall risk factor, you do. So let's make this patient a smoker. So if we do that, her risk, as you can see right here, jumps up to 5.3%, which is over that statin benefit. And her lifetime risk jumps up to 50%. So this is also a great way. I use this in smoking cessation counseling too, because if you plug this in and you say, you're at a point right now where you would need a statin medication, a cholesterol medication, and if we started that, we would decrease your risk to 4%. If we added blood pressure medicine, decrease it to 2.9. But here's the thing, because most patients don't want to be on a statin for whatever reason, they get a bad rap. But you can come over here and say, if you quit smoking, your 10-year risk factor goes down to 3.9%. And that brings you essentially outside of the statin benefit group. So that can be a powerful tool in motivating patients to make significant lifestyle changes. So let's go with another case. So this next patient is going to be a 65-year-old Caucasian male, blood pressure of 130 over 86, total cholesterol is 180, HDL is 39, and LDL is 130. He does not have diabetes, he's not a smoker, he is on high blood pressure treatment, he is not on a statin, and not on aspirin therapy. So we come over here and you can see his risk, even though you might look at his cholesterol and say, oh, 130 is not such a bad LDL, but for him it is. So his risk is 16.2%, which is quite a bit over that 5% threshold. So if you come down here and what the recommendations are, up here it gives you a little summary. So we could more tightly control his blood pressure. We could also start a moderate intensity statin on him too, and both of those would decrease his risk. So if we started a statin, that brings him down to 12.2. If we started or added a blood pressure medicine, that brings him down to 8.9. And he's also a candidate for aspirin therapy. So not everyone's a candidate for aspirin therapy, but that's an important thing to look at too. And when patients ask me, should I be on a baby aspirin every day, this is generally what I use to tell them that. So that gives them a good idea. Another thing that I'll do sometimes, especially for somebody who doesn't take their blood pressure medicine often or doesn't follow their recommended low sodium diet, is I'll come over here and say, okay, let's say your blood pressure is 118/78. Let's say it's in a good goal where it's supposed to be, and see how far that brings it down. It brought down a few points, but not too much. So that's a good tool to utilize with patients as well. Okay, and then my last one is somebody, so this kind of goes both ways. So you may have somebody who comes in who their cholesterol initially looks normal, but they still need to be on a statin medication. But you could also have cases that go the other way, where their cholesterol looks high, but they're not in that statin benefit group. So it's helpful for those patients as well, because then you can still talk about diet exercise modification, but without needing to start that medication just yet. So this is going to be a 45-year-old African American female. Her blood pressure is 115/70. Total cholesterol is 205. HDL is 55. And then LDL is 150. No diabetes. She does not smoke. No history of hypertension, not on a statin or aspirin. And her risk factor here, so even though you might look at her LDL and say it's above 130, it's high, we need to do something about it, her actual ASCVD risk score in 10 years is 0.7%, so that's really pretty good. Lifetime is at 39%. So, and if you come down here on what your risk reduction is, there's really nothing that you can do from the 4 interventions that this calculator looks at to help lower her cardiovascular risk. Now, things that you could do outside of this, and what I usually do, and what they say here, is to talk about lifestyle changes. Your cholesterol is high, it's not in the treatment group, but we should talk about diet changes, exercise to help with that, so that you stay out of that treatment group. Make sure that you're screening for blood pressure at least once a year, and then address smoking cessation as needed. We said she's not a smoker, so these are the ways that I use this tool in patient encounters. Generally, when I have this, I'm showing the patient the screen as well, so they're seeing everything that I'm doing, all the numbers that I'm plugging in, and it really helps not only improve compliance, but it also helps patients understand, what is this medication for, why am I on this, and it helps patients understand the benefits of statins, because again, they do get a bad rap. A lot of people really don't want to be on a statin for whatever reason, whether it's side effects or things that they've heard from other people. So this helps just kind of put that in perspective and say, I'm not just throwing it at everyone, this is why you're in that group. So that's how I use it. I think it's a great tool. It is free on this website, and it's also on the American College of Cardiology website, and it's also a free app. So I utilize both those things, and I'd recommend utilizing it in your practice.